John Etty. I'm a principal clinical psychologist and one of the clinical leads of the Children and Young People's Neurodevelopmental Partnership. Today I want to basically run through, just going to go to my next slide, just a bit about our journey so far, because some of you may be aware of our service, others not, and some of the wider changes in the autism and ADHD pathways in Somerset. So I'll say a bit about who we are, where we've come from, and actually what does this mean in practice, with the important questions being how does a parent, a SENCO, another practitioner in Somerset request an autism or ADHD assessment? What happens to that request when we receive it? And what happens in an autism and ADHD assessment? I'll be talking about both autism and ADHD today, but the systems around ADHD are moving very quickly at the moment, so please bear that in mind. So to start off, I wanted to go right back to where we were before our service came into being back in April 2021. So there was system-wide agreement that the previous assessment pathways for both autism and ADHD were not good enough. Everyone was in agreement around that. There's a CQC and Ofsted inspection report that some of you may have been aware of that really provided some impetus for the change. It really said exactly what the wider system already knew. So everyone was in agreement that change was needed. I've put this quote up from that CQC Ofsted inspection, talking specifically about autism here, but it was also true for the ADHD pathways. The word dysfunctional appears in the first sentence, which, whilst there were lots and lots of practitioners doing their absolute best with limited resources, the system was not set up in the right way. So some of those challenges in the previous systems included that they were very fragmented. For autism, there were 7 pathways for assessment in Somerset, and for ADHD there were 4. So hugely different each one. Lots of inequity in terms of access and quality of assessment between them. Taking a step back and looking at all the assessments conducted across Somerset, many of them were not robust enough, compliant with NICE guidelines, and at risk missed and misdiagnosis. Services were overwhelmed with high demand, and this was largely because autism and ADHD was seen as the golden ticket to a form of support that otherwise isn't available or wasn't perceived to be available. And actually a lot of young people with needs that weren't autism or ADHD were being referred for these kinds of assessments. All those factors together led one of the bigger pathways for autism to close to new referrals. That was in the whole of the West Somerset area, which goes all the way from Wells down to Wellington. Assessment services were very diagnosis-led, not formulation or understanding-driven, meaning essentially they were yes-no services, so do an assessment to give a yes-no answer and then discharge, rather than go beyond that. And we know that communication between agencies and between services and families was not where it needed to be. So, following the CQC Ofsted inspection report, the written statement of action was published in January 2021, which detailed what we as a local system wanted to do to improve this. That formed a working group called Improvement Priority 5, which is one of 10 improvement areas, consisting of ourselves in health services, including our colleagues up in the East Mendip area, which is slightly different because of the way health services are commissioned, our colleagues in social care and education, the Parent Carer Forum, and the autistic community, whose voice is also really important to all of this. Local stakeholders from other services was also involved, and trying to get everyone in the room working together and on the same page about what's needed, essentially. That improvement work within the IP5 group was split into 3 interrelated co-production work streams, so 3 areas that we wanted to improve. First of all, the pre-assessment pathway, then the assessment pathway, and then the post-assessment, post-diagnostic pathway. I'm going to start off now by talking about the pre-assessment pathway, then a bit about the assessment pathway. And we're not going to cover too much on the post-diagnostic pathway at the moment because co-production around that is still ongoing. And we hope to be able to come back in the near future with some very exciting news around that. But we'll wait and see what we get to there first. So what is the pre-assessment pathway, first of all? The idea is this is what we expect families and young people to be offered before a autism or ADHD assessment is even requested. So we know that many young people present with a range of needs, and it's important those needs are understood and appropriate forms of support put in place for those. We call that a graduated responsive support. It should be on a needs basis. Now we know that the vast majority of services in Somerset that are available do not require a diagnosis to be accessed. So we wanted to reverse that narrative that a package of support needs to wait until we have clarity on whether a young person is autistic or has ADHD, because that was serving nobody well. We also wanted to ensure there was a smoother transition and better quality referrals coming in for an autism or ADHD assessment, with lots of information about a young person from multiple sources. This is to ensure that the right young people are being referred for an assessment. So some of the ways that we've done that are we've changed referral pathways in Somerset. So clear advice has gone out to all GPs in Somerset to say, yes, you can still refer to us, but in a lot of cases, you're probably not the right person to gather this information. We know, for example, that parents and schools have a wealth of information about young people, can offer that graduated responsive support both in and out of school, or at least coordinate it with the available other services. So the advice is largely referrals should come through schools or other practitioners working with a young person. That might be in health, social care, education, or other third sector, for example, charities. We've also co-produced a new referral assessment request form called the Neurodevelopmental Next Steps form, which is the form that's designed to give us all the information we need to make an informed decision as to whether a young person needs our service or whether there's another service that might be better placed to meet their needs. There's also been very clear and comprehensive guidance developed to support those offering that graduated responsive support. So the pre-assessment pathway documents can all be found on the local offer website for anyone who would like to have a read through what exactly is expected to be provided. In terms of the assessment pathway, and this is really where our service comes in. So first of all, I should say the Children and Young People's Neurodevelopmental Partnership has been created to replace a lot of the old existing pathways in Somerset as one single assessment pathway for autism and ADHD. I talked about the East Mendip area earlier on, so that's the area beyond Wells towards Frome. Because of the way health services boundaries work, assessments for that group of young people are offered by colleagues in a different NHS trust. HCRG, I always get that wrong because they were called Virgin Care, but in the Bath and North East Somerset area. So I can only talk on behalf of our service, which is the rest of the Somerset area, basically, including what was previously provided for by Yeovil Hospital, Musgrove Hospital, basically ranging from Burnham to Wellington to Yeovil and everything in that triangle. So what did we want to do in terms of the assessment pathway? We wanted to do exactly what we said earlier on wasn't there, make sure there was equal access across the county. I wanted to reopen those closed assessment pathways. We wanted to improve quality, making sure that everyone who requires an assessment gets a good quality, nice, compliant assessment that is for autism is multidisciplinary, and from ADHD has access to a multidisciplinary team to assess all the various complexities where required. But crucially, assessment services had to shift from being diagnosis driven to formulation driven. The purpose of an assessment service is to develop an understanding of a young person with young people and families and those supporting them, and be helpful in doing that. So I think I might have just skipped over my own slide and said a bit about who we are, but essentially the CYP-MP has replaced previous existing partnership pathways into one consolidated one. We've brought together the resource that was previously fragmented across the county in the paediatricians in the hospitals, in paediatric psychology and other psychology teams, the children and young people's therapy services, so occupational therapists and speech and language therapists, those working in CAMS, and also educational psychology employed by the local authority, so bringing them all together within our team. And as I said, what we do is we offer nice compliance assessments from a multidisciplinary team that are formulation driven and therapeutically informed, seeking to understand a young person and be therapeutically meaningful and helpful. So who does our service work with? We work with school and college age children and young people aged 4 to 17 years who have a GP, registered with a GP in what was the East or West Somerset area, which is, as I said, every part of Somerset apart from that bit in the East Mendip area around Frome, and has not previously been assessed. So a few caveats on that. Preschool age children, the pathway for there currently still remains in the paediatric teams at Musgrove and Yeovil. As I said about the Baines service. And we will sometimes do a reassessment, but only if there are valid concerns over the outcome or quality of assessment. Basically, if someone's not had a good quality assessment in the past, then we will consider on a case-by-case basis whether it's appropriate to reassess. And that's regardless of if a diagnosis was or was not given. So what does this mean for you? So if you would like to request an autism or ADHD assessment, the place that we first advise families to go to is their school SENCO. School SENCOs are very, very busy people with a very big job, but they are usually best placed to be able to coordinate a graduated response of support. They can discuss with parents the young person's needs. If there's a difference in how the young person presents at home and school, have an open discussion about that and try and understand why and what that might mean in terms of what support would be most helpful. If parent and school are in agreement that an assessment from our service might be helpful, then the Neurodevelopmental next steps has been developed. This has sections for the parent and the referrer to complete, but also the young person, and the young person's voice is so crucial to all of this. So the advice is any young person who is able to contribute to their referral should be encouraged to do so and be supported to do so in a meaningful way. School SENCOs are not the only way an assessment can be requested though. Other healthcare practitioners within Somerset Foundation Trust, so if a young person is working with paediatrics around their medical needs, a genetic syndrome, a physical health condition, for example, and they think, I wonder, autism or ADHD here, they can refer to us. Likewise, a occupational therapist or speech and language therapist working with the young people around their functional needs or language skills and needs. If they think autism, they can refer in to us. However, we have given clear advice to all teams within Somerset that clinicians should consider whether they are the right person to do that. They can signpost to school SENCO in the pre-assessment pathway, enabling that graduated responsive support. In an ideal world, those healthcare services will work with other people who may be concerned, the family, schools, SENCOs, to gather information together that might inform a referral. As I said earlier, doesn't have to be SENCOs. Any practitioner from across the Somerset area working with a young person from Somerset can request an assessment through the Neurodevelopmental next steps form. This includes GPs. So GPs can still refer to us, but we cannot accept just a letter from a GP. It has to be on the Neurodevelopmental next steps form. completed with both yours as the practitioners, the referrers' concerns, and the parents' concerns. We know that in the busy life of a GP, that's quite a big ask, hence one of the reasons for we generally recommend signposting to School Senko, for example. There are other routes though, because we know that not every young person has access to a health service already or is in school. So Somerset Parent Carer Forum can support parents to request an assessment by completing the Neurodevelopmental Next Steps form together and sending it directly to us. We know that sometimes there is disagreement between families and schools about the need for an assessment as well. Now, we would hope that in those cases, a family, a parent and a Senko could sit down together and try and understand the reasons for that. And we've given advice that if you don't agree, please do just tell us what you know and let us look at the information in its entirety. But if there are any barriers to that, the Somerset SENDIAS service can support completing the Neurodevelopmental Next Steps form. So where do these go? So all requests for a autism or ADHD assessment come to the CYPMP, and we consider each one through our interagency and multidisciplinary triage team meeting. We aim to review every referral we receive within 6 to 8 weeks of receiving it. We know that we are not yet consistently hitting that, but we are very quickly moving towards that. So why do we do that? It's to ensure that appropriate support is provided to those who need it. If, for example, we receive a request for an assessment where it is clear this young person would benefit from support from the pre-assessment pathway, that graduated responsive support, then we may think it's appropriate not to accept that referral then and signpost back to that support first, because what families really want is that support, which in most cases is available before an assessment's even considered with us. But many young people do need an assessment and would benefit from one, and we want to make sure that all those for whom there's good evidence to support an assessment can access one. Once we've considered requests, we send a letter to say, yeah, you're on the pathway, you're on the waiting list, or we say, actually, based on these reasons, we think probably not at this time, with signposting advice. And that might be to gather more evidence, access this form of support and see how that goes first. And we would absolutely reconsider a re-referral if that yields good quality evidence to support an assessment. So the triage decision is only based at that moment in time and based on the information that we are provided with. I want to just myth bust a bit before we finish about then what happens. What does an autism and ADHD assessment actually look like in practice? So every young person, so should say as well, we do have a fairly substantial waiting list for an assessment and are in discussions with our commissioners and the wider group of people in IP5 who I talked about earlier on, providing data on throughput through our service, demand for our service, and making the case to be sustainable and shorten that waiting list. But when a person does reach the top of our waiting list and is able to access an assessment, they are first offered an initial appointment with 2 clinicians from our team. Both clinicians are appropriately trained, registered with the relevant bodies, are there basically from a multidisciplinary team consisting of paediatricians, psychologists, SLTs and OTs with their collective expertise. In that first appointment, we will always try and have 2 rooms to first off hear the reasons why a young person is coming for an assessment and gain informed consent from the young person and their parent, get a really good sense of the context of a young person's life, hear from the parent about early development and any factors which might have influenced development that might suggest maybe something other than autism or ADHD could be driving those needs. It'll also involve play-based assessment or interactional assessment, conversation with a young person, and gathering a lot of information from parents. In some cases, very few, 1 appointment is enough to reach the conclusion for an assessment. And in some cases where a family has headspace to hear that at the end of a fairly intense hour and a quarter of us asking questions, we're able to feedback there and then. However, the vast majority of young people's assessments take place between 2 and 5 appointments and involve us liaising with others who work with a young person. That could be anyone who's worked with a young person in education, health, or other services. There's a range of different assessment approaches we can use to explore autism, or things that look like autism but aren't quite, things like learning needs. So doing a psychometric assessment and exploring things like learning disability. We might consider language and whether language needs specifically have impacted on social communication, which can look like autism but isn't quite. Genetic or medical needs likewise can look like autism, but that's not the right way to understand them, as can a young person's responses to very difficult or even traumatic life experiences. We know that some of those responses can sometimes look and appear similar to those experienced by autistic young people or those with ADHD, and that can be a hard thing to unpick, and that's why we have an experienced team here. At the end of the assessment, every young person gets an assessment report written to them, written in a strengths-based, neuroaffirmative way that describes to them, this is what we've noticed. This is where we think you're having difficulty, and this is why. And these are your strengths, and this is what you're really good at. And then, as we are an assessment-only service for autism at the moment, that will be the end of our work, but everyone is offered, regardless of outcome of the assessment, a chance to meet with us after they've had time to digest all of that. ADHD actually looks pretty identical to this. The only difference, and I've added the green bit in the top right for this, is that the first assessment is with one clinician. And that's because NICE guidelines for autism state it must be from a multidisciplinary team, whereas it doesn't for ADHD. Many ADHD assessments do require an MDT, 2 clinicians from different backgrounds, but it has to for autism. So I think that is everything from me. So thank you for listening.